So today I'm here with Amanda Lugg, who is the Director of Advocacy for African Services Committee. Hi, Amanda. How are you?
Hi, I'm very well, thank you.
So I was wondering if you could start us off and just tell us a little bit about what you do for African Services and where you do it.
Sure. As you said, I'm the Director of Advocacy at African Services. I've been at African Services since 2001. The organisation itself has been around for 30 years this year, 2012. We're a community based organisation based in Harlem, New York City, and we serve the African and Caribbean immigrant community of New York. We have a range of social services, legal, food pantry, English language classes from French to English. But our main focus is HIV and AIDS with a testing centre, case management, AIDS housing, AIDS support groups. And we also operate 4 HIV testing centres in Ethiopia.
Oh, so I understand from talking to you a little bit before we started filming today that you guys are doing some interesting work regarding the inclusion of immigrants into the national HIV epidemiological data. Could you talk about that a little bit?
Yes. For far too many years, unfortunately, the way that HIV epi data is gathered in the United States pretty much obscures foreign-born black immigrants from HIV data. As many people will be aware who are watching this, when you fill out your information, your demographic information, when you take an HIV test, for those who are people of color, you have black/African American. And so if you're African or Caribbean, you would of course check black African American. However, those results generated are then translated into African American results.
Right. So you miss. It sounds like with this current system, you miss quite a bit of the important nuances of the
Exactly.
populations that are affected by HIV.
Exactly. Completely makes these communities invisible within real hard concrete data. And of course, it's so important to be able to have that data, to be able to know the extent of the epidemic within those communities. And of course, they take a completely different cultural and linguistic approach, or rather, they need a very different cultural and linguistic approach in terms of outreach, prevention, and care.
Sure. So, could you talk about a little bit about the work that you're doing right now and some of the initiatives? I know that some of these issues come up with the Affordable Care Act, as well as the National HIV Strategy of 2010.
Right, yeah, it's very particularly important right now as immigrants and more specifically undocumented immigrants who are a large number of folks that we serve. African services have no immigration status in the US, and these folks are excluded from both the Affordable Care Act and in the National HIV/AIDS strategy. This is why more than ever we are very active within the advocacy AIDS community, making sure that we are present at the tables. An example is the 30 for 30 campaign, which is looking at the epidemic as it affects and impacts women in the United States, and we're there to represent the voices and needs we've of also recently completed a study on HIV/AIDS within the African community in the US. We're very happy to have found out just last week that it will be published by the Journal of Immigrant and Minority Health in the hopefully the September issue 2012. And we're going to be using this as an advocacy tool to really push for this further stratification of HIV surveillance data to include world regions of origin on our data too. If we really want to address health disparities within the United States, immigrant communities very much need to be a part of that data collection.
Yeah, that's exactly right. So, for the people watching this, what can they do to get involved or to help the cause of making sure that immigrants in the future are covered in HIV and AIDS policies in the United States?
Well, I'd say in terms of the in short term, with the negotiations going on currently around the Affordable Care Act, it's really up to the states with the state health exchanges be involved in discussions statewide around the inclusion of immigrants in those health exchanges. And again, wherever the opportunity arises, if you're an immigrant, if you advocate for immigrants, be at that table. Like we say, if you're not at the table, you're sure to be on the menu.
All right. Thank you so much, Amanda Lugg. I appreciate your time.
You're very welcome.